is people are confused about who we are. And until they understand that, it's hard to kind of understand what the change is. So if you don't mind, I'm going to kind of start there. I'm going to actually go back to before I was born, in 1929, when doctors Michael and John Fallon founded Fallon Clinic as a medical group, just a group of doctors. Oh, great. You know, I often find people who actually have a memory to know the early days of Fallon Clinic. So back in the early days, it was a medical group of doctors. And fast forward some decades, again, before my time in Worcester, and the medical group decided to essentially form an insurance company. And the insurance company's name is Fallon Community Health Clinic. So the doctors of Fallon Clinic and Fallon Community Health Plan operated together, and at that time, up until the early 2000s, up until about 2003 or 4, if you had a Fallon Clinic doctor, you had to have Fallon Community Health Insurance, and if you had a Fallon Community Health Insurance, you had to have a Fallon Clinic doctor. That's how the two companies worked. But they separated, and it was before my time, but I believe it was in 2003, 2004. The two organizations had kind of a friendly divorce. So the insurance company went off to be just an insurance company, Fallon Community Health Plan, and Fallon Clinic went off to be just doctors, just like they started out in 1929, just doctors. They were two separate legal entities at that point. So you got Fallon Community Health Plan being an insurance company, and Fallon Clinic being a group of doctors. Now, the two organizations did then and still do today work together. Fallon Clinic doctors accepted Fallon Community Health Plan insurance, but they also started accepting Blue Cross and Harvard and Cox and United. And Fallon Community Health Plan had members that didn't have to have Fallon Clinic doctors. So they remained friendly, but separate. The problem for a lot of people is they both kept the name Fallon in their names. So it was very confusing because they thought it was still the same organization. People would come to us and say, oh, I'd love to have Dr. Kavanaugh, but Dr. Kavanaugh, I had Blue Cross. And we'd say, but you can come now because we take all the insurance. We're not part of Fallon Community Health Plan anymore. So we really had a hard time getting people to understand, and I don't blame them because both companies didn't want to give up the Fallon name. So about a year and a half ago, we decided, the group of doctors said, we need to do something that shouldn't be confusing to the marketplace. So we decided to change it to Reliant. So I just wanted to level set with that. So now Reliant Medical Group is Fallon Clinic with a new name. The doctors didn't change, the locations didn't change, everything stayed the same, but we did change our name to help people understand the difference between us and Fallon Community Health Plan, and to know that we're a group of doctors, we're not an insurance company. So that said, I'm not here today to sell insurance. That's not my job. What I want to do today is talk to you about the change we're making in the Medicare plans we accept for 2014, and let you know your options if you want to keep your Reliant Medical Group doctors. So that's my goal today. So I can't answer questions about insurance, premiums, and all that stuff. I can tell you some of the timelines about when those pricing and everything come out, but I can't answer specific questions about insurance. Does everyone here have Reliant Medical Group primary care doctors? Right. So you either go to maybe to the Auburn or the Millbury sites or whatever. So if you have a Reliant Medical Group primary care doctor and you have Fallon Senior Plan, this change does affect you. So
I gotta go. Be back.
So Fallon Senior Plan is a type of insurance product called Medicare Advantage. Does everyone know that it's a Medicare Advantage? Okay, good question. So I'm not a big Medicare expert, and the insurance companies can probably talk to you more about it, but I can give you the high level Medicare 101. When you become 65, you become eligible for Medicare. And at that time, you can have Medicare Part A, which generally covers your inpatient care. And then you can also get Medicare Part B, which is outpatient doctor's office, like when you go to Reliant Medical Group for care. I think you have to pay a premium for Part B, but you become eligible for Part A and Part B. And a lot of people refer to that as original Medicare, Part A and Part B. A lot of people, however, don't, can't, Medicare Part A and Part B doesn't cover all the costs of Medicare. So a lot of times what they'll do is they'll use their Medicare Part A and use it as inpatient and their outpatient. But they'll buy a supplement plan, a Medicare supplement plan. Sometimes people call it Medigap because it covers what A and B don't pay for. So what they use to pay for their medical services is Medicare Part A and B, their Medicare card, And then a supplement plan they might buy from a company like Fallon or Tufts or Harvard or Harvard. There's that supplement plan. And there's something called Part D, which is your prescription coverage. So some people buy prescription coverage as well. So they have Part A, Part B, Part D, and a supplement. Now, some people buy Part C, which is a Medicare Advantage plan. And a Medicare Advantage plan is, generally speaking, if you have a health plan, it's a Medicare Advantage plan. So you have bundles, a lot of these Medicare benefits. So you don't have to worry so much about the Part A and the Part B because it's in your Medicare Advantage.
Let me see what I can
And there's
do.
other benefits too. There might be a gym membership or silver sneakers, and there might be some other benefits. But you buy your Medicare Advantage or your Part
Yeah,
C
you know, I'm sure they're all right.
a private insurance. So the private insurance companies sell Medicare, which is why you go to Fallon for your insurance. You don't use the federal government because you buy a Medicare Advantage plan, and the government gives private companies permission to provide Part C or Medicare Advantage. Yes, and it kind of bundles all the stuff. And you usually just show one card when you have Medicare Advantage. You show your Fallon Senior Plan card when you go to the doctor. If you had Medicare with a supplement, you would show your Medicare card, because Medicare pays first, and then your supplement card. But Medicare Advantage is attractive to a lot of people because it does kind of bundle all of these benefits in one plan that you buy from a local or even a national insurance company. And it's convenient and cost effective for people too. Medicare plans tend to be more cost effective than a supplement plan, although that's not always the case. It really depends on what you need because the Medicare Advantage plans have different price levels within them. Right? So that's kind of how Medicare Advantage works. Now, we will only be accepting one Medicare Advantage plan in 2014. Today we accept two. We accept Fallon Senior Plan and we accept Tufts Medicare. And in 2014, the only Medicare Advantage plan, the only plan that's similar to what you have now because it's a Medicare Advantage plan, in 2014 that Reliant doctors will take is Tufts Medicare HMO. So, I know that's a big change for some people, and so it's important to understand the options because I will tell you that if you have Fallon Senior Plan today, and if you do nothing during the open enrollment period this fall, if you do nothing, you will probably auto-enroll to stay with your current plan. And if you do that, your Reliant doctors won't accept it starting on January 1st. So you've got to make a change if you have Fallon Senior Plan. I'm not here to tell you which company to change to. But you have to make a change if you have Fallon Senior Plan and you want to keep your Reliant doctors. So those are the two things. If you want to keep your Reliant doctors, you can't have Fallon Senior Plan as of January 1st. So you'd have to make a change to that during the annual enrollment, which starts on October 15th and goes to December 2nd. So what are your options? So if you want your Reliant doctors and you want a Medicare Advantage plan, because you've done your homework, you like the Medicare Advantage plan, you're comfortable with it, whatever, the one that we will be accepting is Tufts Medicare Preferred. So if you want your Reliant doctor and you want a Medicare Advantage plan, your option would be to switch to Tufts Medicare Preferred. Let's say that you don't care so much about Medicare Advantage plan. You still have options. You could use your Medicare Part A and Part B and get a supplement plan. We accept pretty much all supplement plans. We accept the Fallon supplement, the Tufts supplement, the Harvard-Pilgrim supplement, the ARP supplement, the Humana supplement. Pretty much any supplement we accept. So there are people that say, I'm going to use my Medicare A and B that I'm eligible for when I'm 65, pay whatever premiums are associated with that, and also buy that supplement and marry the two, and I've got my health insurance. So we're only going to accept the one Medicare Advantage plan, Tufts Medicare Preferred, but we will accept all supplements. So that's an option for people. They can get their Part A, Part B, they can buy a supplement from any company, whether it's Fallon or Tufts or Harvard or Blue Cross, they can do that. Now some people are able just to use their Medicare Part A and B, which we will continue to accept. And that's all they use. They might pick up Part D for some prescription coverage, but we accept all the parts, except that we only accept one of the Part C Medicare Advantage plans in 2014. So that's like the basic facts. Does anyone have any general questions on the change?
Yes, I'm wondering how I pay a certain amount every month. I don't know whether I'm advantage or not.
Well, if you have Fallon Senior Plan, if your insurance card says Fallon Senior Plan, you have a Medicare Advantage type of plan. you have that Part C plan. So,
So you can tell by looking at it.
yeah, if it says Fallon Senior Plan, HMO, it's a Medicare Advantage plan. That's Fallon's Medicare Advantage
That's
plan.
wrong, the same thing.
Yes,
I don't
well,
even know what I
I know.
already got it working.
She's got a better plan than I do, but I never knew.
Right. So, and as I said, when you have Medicare Advantage plans, whether you buy it from Tufts or Fallon, there's different levels, and they cost different amounts, and it's based on the benefits you get. So you got to see what you need. That's how you pick what plan you're going to have under senior plan, right? Is what benefits you need.
So what you're saying is somebody like you, $17, I don't know. Can I get my card and say, this is what you have, this is what you.
I can tell you, if it says Fallon Senior Plan, I can tell you that you have Fallon Senior Plan, that's Medicare Advantage plan, but I can't tell by looking at your card what level you want.
So I have the advantage.
Yes, you have to. So we won't accept that Reliant doctors starting in January. So if it says Fallon Senior Plan on your card, we won't accept it on January 1st. Now, we talked about the options, so you could pick another Medicare Advantage plan from Tufts.
How about the supplemental for the supplemental one?
I'm not sure what you're looking at.
What I'm looking at.
Right. So again, I can't talk about insurance specifically, but if this says a Medicare supplement plan, we accept Fallon's supplement plan in 2014. We just don't accept the Fallon Senior Plan in 2014.
But that's all right, if I purchase one of those, I'm all right.
Yes, if you purchase a Fallon supplement, we will accept that in 2014. If you want to go from one Medicare Advantage plan to another Medicare Advantage plan because maybe you like that setup, then the only option you'd be able to have in order to stay with your aligned doctors would be to go with the Tufts Medicare Preferred Medicare Advantage.
So that's the easiest thing.
Well, it depends on your circumstances, but if you like the Medicare Advantage plan and you want to stay with the Medicare Advantage plan, there's only going to be one option with Reliant starting on January 1st.
So, in other words, if I'm totally satisfied with what I've got, my option, the best option is to switch to Tufts and go with Van Premium, what I got.
I can't really tell you what your best option because it's your particular circumstance. I can tell you if you like a Medicare Advantage plan, there's going to be a Medicare Advantage option at Reliant, and it would be Tufts Medicare Preferred HMO. Now, one thing I want to make very, very clear, when you have a Reliant medical group doctor, and you have Fallon Senior Plan, as I said before, you can't have Fallon Senior Plan and still have your Reliant doctor on January 1st. Your card might change, meaning that you might get a different plan, you got to get a different plan, but the care is not going to change. It's very important that people understand that. People changing insurance doesn't mean your care changes. So what I've been saying to people, your card might change, but your care is not going to change. Same doctors, same location. The doctors are going to refer you to the same doctors. We primarily still use St. Vincent Hospital. So if you choose to move to Tufts Medicare Preferred HMO, or you choose to go to some kind of supplement plan, your care is not going to change. Your benefits might change slightly depending on the kind of plan that you buy, right? That's what you need to do your homework about. But the care is not going to change. So you can't do anything until October 15th because Medicare annual enrollment doesn't start until October 15th, and then you have till December 7th. But my suggestion to people is to do their homework, which it sounds like the ladies are doing. You know, call the insurance companies. If you might be interested in a Medicare Advantage plan, call Tufts, get on their mailing list. That way, when their rates become available, they can send them to you. The rates become available for 2014 on October 1st. So Fallon can't tell you what their 2014 rates are. Tufts can't tell you what their nobody can until October 1st. But it doesn't hurt to get on the mailing list so that as soon as they're available, you get something in the mail. And you can't make a change now, but you certainly could give Tufts a call if you're interested in the Medicare Advantage plan or any of the other companies. They'll send you stuff. You'll get a lot of mail after October 1st, but at least you'll get the information you're looking for.
What is probably the best way to go? If
Yeah.
you can understand the information that you get.
Yes, if you can understand the information. But if they know that you have interest in their information, they'll put you on the list, and then when they can communicate the new rates and the plan designs, they'll send them to you in the mail. So we're saying, you know, do your homework now, get on the mailing list of any of the plans you may be interested in, and you can do that now. You can't make a change now, but that's one thing you can do, and you can collect your information. So when you can make a change if you want on October 15th. You'll have to leave.
Yeah, my doctor is Kathy Relay.
In Auburn, yeah.
Will those doctors stay there? Or will we have to go someplace else?
No, if your card changes, if you pick a new insurance to stay with it, but your care does not change.
So I can still go to this building?
Yes, so you'll have a new card. Let's say you choose to go to Tufts Medicare Preferred HMO because you like the Medicare Advantage plan and you like your Reliant doctor. Let's say you do that. You're just going to show a different card. There might be different pricing. You've got to do your homework on that. Might be less, might be more, we don't know. But you really just have a different card. I can't tell you that someday Dr. Gaines isn't going to retire. But what I can tell you is, unfortunately, I can't get, make sure that the sign in blood that they're never going to leave. But this change is not going to affect the care that you get at Reliant. What you've experienced is what you're going to continue to experience, because our care is like insurance blind.
Would you say, like now there is no price, there is price set right on these different?
What they're showing you, I think, is what today, like in 2013 pricing. So it's probably just to give you, like if you called Tufts today, they would be able to talk with you. Here's what the 2000, if you chose Tufts in 2013, here's the kind of pricing you would have paid. Kind of might give you an idea, but really until 2014 comes out, we don't know what Fallon's going to charge or what Tufts is going to charge.
You have your hand up. But you see, the thing is,
I do, and I can get you on the Reliant changes, but not on insurance.
it said you could qualify for 15% discount on these prices. So evidently,
No, we were talking to the neighbors.
I don't know. And you know what? I couldn't even answer the question because that would be a question for Fallon. Community health plan.
You're
It's
only
their
there like 3
product.
months of the year.
Yeah, you really do have to talk directly with the insurance companies about the way that the plans are designed and the way their pricing are cost. Because, as I said, Reliant Medical doesn't sell insurance. We can tell you the insurances we accept, and we can talk to you about this change, but your decision about which
and
plans
now
you like.
it's just a medical.
Not an insurance company, it's a medical group that takes different insurances.
All right.
Yes, yeah, right, and, as I said, that's one of the reasons we changed our name to help people to understand that we're just a medical group, Reliant Medical Group.
And the thing is, none of them carry the Part B drugs.
No, you have to do your own.
Part D.
Right,
This was a handout that we got.
right. Yeah, again, those are insurance questions, and I just don't have the answers to those. I can't talk to you about premiums and all those
The way
things.
they explained it was that this is a state regulated.
Yeah, again, that's insurance. It kind of, I don't have all that knowledge that you were talking about.
He didn't say a word about Tufts, though, remember?
No, because he said that this is a state regulated.
Well, if it was a presentation by Fallon, they wouldn't be talking about Tufts. And if it's a presentation, Tufts are not going to talk about Tufts.
It was a Reliant.
No, not at the Hampton. No, we didn't.
No, that was Fallon.
Is that Fallon?
Yeah, that was Fallon.
He didn't say a thing about Tufts, though, remember?
Because if he's with Fallon, he wouldn't talk about Tufts because they're competitors.
This is the only thing that he talked about.
Right.
That came at the end of 5 issues of paper.
Yeah.
That's when he handed us this and said, this is your, like, this is your answer.
Yeah, but see, this is what he gave us.
But this is a Fallon senior plan, Medicare supplement option.
Right. That's not a Medicare Advantage plan. So it's important.
Is it not Medicare Advantage? That's what I wanted to hear.
That's
State regulated. It comes under the state insurance.
Yeah. So you know what's very important for you to know who's giving you a presentation. So today, you're hearing from me. I'm with Reliant Medical Group. I'm with the doctors. It sounds like when you were at the Hampton Inn, you were talking to someone from Fallon. And it might be that, Tufts is going to have a presentation someplace.
Yes, because
So you got to know who's talking to you. That's important. That's part of you doing your homework.
by Fallon.
Right. So when Reliant talks to you, I'm going to talk to you about the doctors and what the doctors will accept. And when you go to a Fallon presentation, they're going to talk about their products. When you go to a Tufts presentation, they're going to talk about their products. So know who's talking to you. Know who's talking to you. So that'll help clarify things for you. You want to know who's giving you the information. You got to understand.
Now suddenly I have to know what it's all about.
Yeah, that's why the change is difficult for
This is
some
why,
people.
like I say, after a certain age, you don't like to make changes.
Yeah,
That's the way to go.
You're right, change is not easy, and some people don't ever change their insurance, they just keep auto-enrolling every year on the same plan. And
If you like it, you don't want to change it.
right. And you know, we do apologize for that the inconvenience factor of this. We would not partner exclusively with a plan, like a Medicare Advantage plan, if we didn't think that it was a good plan, and if our doctors didn't think that working with that plan really helps them provide good care. And
And this combination we're talking about.
right, the Medicare Advantage plan. So remember, we're taking one Medicare Advantage plan in 2014. It's the Tufts Medicare Advantage plan. But we're taking all of the supplements as well. So you really have to look and see what you get with your plan.
They call that preferred. They have
Tufts Medicare Advantage plan is called Tufts Medicare Preferred. Fallon's Medicare Advantage plan is called Fallon Senior Plan HMO.
So if I call up Tufts and I say, I like what I've got, what have you got to offer me? You got my clothes.
Sure, exactly.
Then
Well,
I
they
don't
would be
have
able
to go back and
to.
say, good, they did a good job.
They'd be able to talk to you about 2013. They'd be able to say, well, here's what we could have done for you in 2013, and here's what it would have cost you, and here's what it would have included. But they're not going to be able to tell you about 2014 until October. And the thing about the Medicare Advantage plans that I should tell you is both of them, whether it's Senior Plan or Tufts, they use an HMO model, which means that you stay within a pretty close circle of doctors. So when you have found Senior Plan now, if you have a Reliant primary care doctor and you need to go to a neurologist, there's a likelihood that they're going to send you to your Reliant neurologist. Or if you need a podiatrist, the same thing's going to happen if you get Tufts Medicare Preferred HMO, because the way those Medicare Advantage plans, you have a tighter circle of doctors so that your care can be managed and coordinated. With supplements, you go to any doctors you want. Supplements are different. Medicare Advantage plans, you can't go to any doctors you want. You go to the doctors that you and your Reliant doctor think is best for you. So the doctor really helps coordinate your care more. There's not as much of coordination with supplement plans. You have more choice, but you don't have as much coordination. So you can expect with a Medicare Advantage plan, whether it's the Fallon or the Tufts, that you're going to get referred to the same group of doctors if you have a Reliant PCP. If you went to the Tufts Medicare Preferred HMO, you'd still pretty much have the same referral kind of, your doctor will have the same referral pattern.
So what do
You know, mostly refer you to Reliant doctors unless your needs can't be met at Reliant, and then they work with you to see outside of Reliant where you need to get your needs met. But it's Medicare Advantage plans really, they really facilitate a partnership between the patient and the doctor. You know, very close partnership there. Which is another reason some people like it.
Someone was in a week or so ago, he said, he's from another town, he wanted to get medical insurance from them. And he said, I don't have to do anything because they're going to take care of everything.
Yeah, that's probably,
Price-wise and everything.
yeah. So,
It's a group plan.
right, so what she's talking about is some people get their insurance from their former employers. So it might be the city or it might be the company, in which case you've got to deal directly with that company. That company offers retiree service insurance. And some of the companies offer both of these Medicare Advantage plans, some of them offer only one, some of them offer one Medicare Advantage plan and a supplement. So that gentleman probably shouldn't assume that it'll all be taken care of, because everyone's going to have to make a change if they have Fallon Senior Plan and they want to keep their Reliant doctor. Nothing's going to happen automatically, I've got to tell you that this fall. The bottom line is if you have Fallon Senior Plan HMO, whether it's from a company or whether you buy it on your own, we will accept it. So here's the big thing. If you want to keep your Reliant doctor, big if you want to keep your Reliant doctor, and I obviously hope you do, you can't have Fallon Senior Plan on January 1st because we won't accept it. You can have another plan that we accept, but we won't accept Fallon Senior Plan. That's kind of the bottom line. You know, the doctors can't come to these sessions that I do because they're patients, but I say on their behalf that we really hope that you pick up a plan, whatever that plan is, that allows you to see your Reliant doctor. We want to continue to Our doctors feel like their senior patients are the most loyal patients. They've had the longest relationship with them, and you know they hope you pick a plan that will accept Oh my goodness.
She knows she went for parking, but wasn't there.
Oh, good. Good for you. You're doing your homework.
Personal incidents with the doctor, like, what, you know, I see them more than one, so by the second time, I
Back to
felt
Melanie.
I knew them.
Sure.
Now we know how nice you
Yeah.
And so I personally said, well, they have it. And well, I had the same answer. We don't want to lose our senior ones.
They don't want to lose their senior patients.
They
And,
said exactly what you said.
right.
They said,
Yeah, because and I don't tell them what to say, so they really feel it. And that's the thing, you know, your relationship with your PCP is something you build over time. Strong relationship, and you know, we hope you don't take it lightly. If there's a way for you to stay and you want to stay, we're very happy. But you will have to pick a plan that we accept on January 1st. And that window of time between October 15th and December 7th is important, because if you miss it, you can't see your doctors on January 1st. You don't have to wait the whole year till the next year's annual enrollment. It's October 15th through December 7th. That's the only time you can make a change until next year. So if you have found senior plan and you want to stay with your Reliant doctor and you don't make a change this fall, you're going to lose your Reliant doctor. And if you want to come back, you have to wait a whole another year to pick an insurance that they accept. December 7th, after December 7th. And if you haven't changed your plan, if you haven't changed your plan, you'll be able to see your Reliant doctor until the end of the year. On January 1st, we won't accept that insurance.
Well, I kind of think the way it is now, we all have a general plan, right? So I can get my doctor. I only know one doctor will plan.
Well, that's going to be your decision. And in any case, I really think it's good that you have your homework now. You're getting informed, so that October 15th doesn't come up as a surprise to you and you say, oh no, now I got to get all my questions answered. We'll still be around to answer your questions then at our sites, and I'll come back here as many times. But one of the reasons I've gone to about 20 senior centers in the past 2 months, because I have two concerns. One is that I don't want anybody waking up on January 1st not understanding what happened. I want them to understand the change. They have to make their choices and decisions, and those are theirs to make, but I don't want anyone waking up because they didn't understand or they didn't know. Because that would be awful. And the other thing is I try to encourage people to get the answers now so that they don't feel under pressure between October 15th and December 7th, that they feel ready. You know, they got to look at the rates, they've got on all the mailing lists, they've called the companies, so the stuff's coming to them, they can look at it all and get your table and feel like I don't have to chase information, it's coming to me. And I get told that, you know,
And when you call the office, that's all down.
well, it depends on customer service, because Fallon has a customer service department, Office has one. So again, it's just like know who's talking to you, and you already know who you're calling.
Well, no, we only have one number to call.
Well, if you're calling the number on your card, you're calling back.
Fallon.
Yes.
So when we call, now, if we want to know about customers, we have to call the
Exactly. And I'm going to go get a handout, and it'll have some important numbers on it. I left it in the car, but I'm going to go get it.
I just call last week, but all they can do is answer separate
Right?
and what I have now. They didn't want to tell me anything. Not that they didn't want to tell me, they didn't know me.
You were tuned up. So one of the things, looking at the Fallon supplement, one of the things might be that you're able to save the Fallon and with the line covers without Fallon supplement.
Say
have
like
like
that.
one of each
Share
year,
without.
you got a supplement. Alberta supplement's not a Medicare Advantage plan. So that's why you want to take a look at all your options.
So many people, what's the name, just sit down and I get 2,000.
Do you have any idea when the fly's gonna be out?
Benefits managers or benefits administrator. So if that man becomes public,
Oh, she doesn't know in there either.
at the end of the day,
Oh,
She would know more than I would.
It's late, that's all. You're Joyce, aren't you?
Yes.
I thought you were. Yeah. So, yeah,
so
I
he
just
should
yesterday.
get, and then we'll send him the
Am I bothering you?
and he'll see what his options are. And some companies, you know, are still deciding whether they want to go. A lot of companies are interested.
No, we know that.
It's kind of, it's all moving until that enrollment period, and then all the information becomes online. But he should be in touch with the benefits administrator for the retirement plan. Any other questions? And if they're personal, we can turn the camera off. We've been kind of fairly general now, but yeah, I mean, everything you asked about in terms I couldn't really answer. So, sorry about that, but.
That was a lot.
Go for it.